If you have taken a blood pressure pill every single morning for the past year, the same little tablet, the same glass of water, the same routine you barely think about anymore, I want to ask you something that might make you pause. How confident are you that you actually understand what that pill is doing inside your body right now at this exact moment? Not what the label says, not the one line a pharmacist rushed through while handing you the bag. I mean, truly understand it, the way it works, the way it can quietly turn against you under the wrong conditions, and the difference between a symptom that is simply annoying and one that means you need help immediately. Most people, when I ask that question, go quiet. Educated people, careful people, people who read the news every day and manage their own money without a second thought. And that pause tells you something important, because these medications are not gentle. They are not vitamins you can take without a second thought. The pills many people call Amlodipine, Losartan, and Lisinopril are powerful substances that reshape how your heart, your blood vessels, and your kidneys behave every single day, hour after hour, whether you are thinking about them or not. And yet millions of people take them on autopilot with almost no understanding of what to watch for, what to avoid, or when something that feels completely ordinary is actually the body sending a warning it desperately needs someone to notice. By the end of this, you are going to understand these three medications in a way that makes you safer, calmer, and far less likely to be blindsided by something you could have seen coming. And I want to start with a story, because this story sets up everything else. And once you hear how it ends, you will never look at a swollen ankle the same way again. There was a man, sharp and methodical, the kind of person who had spent a career solving problems for a living. He never missed a dose. His routine was built like a machine, a pill organizer labeled for every day of the week, checked and rechecked like a project schedule. When his doctor added a new blood pressure medication to what he was already taking, he assumed it was nothing to think twice about. Same category, different name, no real difference. That single assumption very nearly cost him a year of his life, and he had no idea it was happening until his own shoes stopped fitting. 3 months in, his feet had swollen so much he could not wear his regular shoes anymore. By 4 in the afternoon, his legs felt heavy, almost foreign, like they belonged to someone else. He started avoiding walks because moving made it worse. He told his son he thought his circulation was failing. He started searching online for heart failure symptoms late at night, alone, frightened, convinced something serious was unfolding inside him. The real explanation was far simpler and far more manageable than what he feared, but he had no way of knowing that, because nobody had ever explained to him that these three medications, despite all doing the same basic job of lowering blood pressure, are not remotely the same drug underneath the surface. They all bring pressure down, but that is where the similarity ends. One works by relaxing the walls of your blood vessels directly, easing the tension in the arteries so blood can move with less resistance. Another blocks a specific chemical signal in the body that tightens blood vessels in the first place, so blocking it allows things to loosen naturally. The third works at a similar stage in that same internal system, but through a different door, and that difference matters far more than most people ever realize. 3 different mechanisms, 3 different personalities, in a sense. 3 completely different sets of things to watch for. Once you understand that, you stop interpreting every strange sensation in your body through the same lens, and you start recognizing which symptom belongs to which medication, which is exactly what that man eventually learned once someone finally connected the dots for him. His swelling was not heart failure. It was his new medication doing precisely what it is known to do in a meaningful percentage of the people who take it, relaxing the small arteries in the legs more effectively than it relaxes the veins responsible for carrying blood back up toward the heart. Once that imbalance was identified and addressed, he was back in his walking shoes within weeks. But here is what should stay with you. The label on that bottle is never just a name, it is a category, and the category tells you the pattern to expect. If you do not know the pattern, every new sensation feels like an emergency. If you do know it, most of them simply become familiar territory. Let's go deeper into that swelling, because it is one of the most misunderstood side effects in the entire world of blood pressure treatment, and it quietly affects far more people than you would guess just from looking around a waiting room. Here is what is actually happening beneath the surface, explained simply. When this type of medication relaxes the small arteries in your legs, blood flows in more freely than before. But the veins, which are responsible for carrying that blood back up toward the heart, do not loosen in the same way. So an imbalance forms. More blood arriving than leaving. Pressure builds in the tiny vessels near the ankles and feet, and eventually that pressure pushes fluid out of the vessels and into the surrounding tissue. The result is puffy ankles, socks that leave deep grooves in the skin, shoes that suddenly feel a size too small, legs that feel swollen and tired by late afternoon. This is not fluid retention from too much salt at dinner. It is not a sign that your kidneys are shutting down. It is not the beginning of heart failure. In the overwhelming majority of cases, it is simply a predictable physical response to how this particular medication works. Now, here is the part that becomes genuinely dangerous, and it is not the swelling itself. It is how people react to it once they notice it. Some people see the swelling and quietly decide, without telling anyone, to stop taking the medication altogether. Their blood pressure creeps back up in silence while they feel they made a perfectly sensible choice. Others keep taking it, but start cutting back on water because they believe they are retaining fluid, which pushes them in exactly the wrong direction, since dehydration on this type of medication carries its own set of risks. And some people, like the man in our story, simply endure it in silence for months, cutting back on activity, assuming the worst, quietly losing quality of life for no real reason at all. The move that actually protects you is simple to say and easy to forget. Swelling like this is a conversation your prescriber needs to hear about. Not necessarily because the medication is wrong for you, but because there may be small adjustments, alternative timing, or even a different medication entirely that fits your body more comfortably. Elevating the legs in the evening, changing when the dose is taken, or reconsidering the medication itself are all real options. But none of those options ever get explored if the symptom is suffered through in silence. If you have ever noticed that heavy, swollen feeling in your legs by the end of the day and simply assumed it was normal, you are far from alone, and it is worth saying out loud to someone who can actually do something about it. Now let's talk about the medication most known for a very different and very stubborn side effect, one that tends to catch people completely off guard because of how long it can take to show up. It starts as a dry, scratchy, relentless tickle at the back of the throat. Not wet, not productive, nothing that responds to cough drops, lozenges, antihistamines, or anything else sitting in the medicine cabinet. And here is what makes it so tricky to catch. It rarely announces itself right away. Some people develop it within the first week of starting the medication. Others do not notice it for 3 or 4 months, and by that point, the connection to the pill they have been taking every morning without incident never even crosses their mind. They have been on it for months without a problem, so they blame dust, seasonal allergies, a lingering irritation from a cold, or acid reflux. There was a woman, an avid gardener, who assumed her cough was simply from spending so much time outside during pollen season. It was late spring when it began, which made the timing feel completely logical. She tried antihistamines. She bought an air purifier for her bedroom. She mentioned it to her doctor, who ordered a chest scan that came back completely clear. 6 months later, the cough was still there, disrupting her sleep almost every single night. She was exhausted, irritable, and beginning to fear that something serious was being missed entirely. The question that finally cracked the mystery open was simple. When did the cough start compared to when the medication started? She paused, pulled out her phone, and began doing the math in real time. She had started the medication 11 months earlier. The cough had appeared roughly 4 months into treatment. She had never once connected the two. Once that link was made and the medication was switched, with her doctor's guidance, to a different one that targets a similar system without triggering that particular reaction, the tickle in her throat disappeared within 2 weeks. 11 months of broken sleep, resolved in 14 days, the moment somebody finally connected the dots. But here is where I need you to pay very close attention, because there is a line in this same category of medication that separates a nuisance from a genuine emergency, and that line is not always obvious until it is almost too late. If you are taking this type of medication and you notice swelling of the lips, the tongue, the face, or the throat, especially if breathing or swallowing starts to feel difficult, You do not wait to see if it passes. You do not plan to call the office in the morning. You do not take an antihistamine and hope for the best. You call for emergency help immediately. This reaction is rare, but it is real, and it can close off an airway faster than most people would ever expect. A dry cough is an annoyance. Swelling in the throat is an emergency. The space between those two things could not be more important, and it is worth holding on to that difference permanently. Now let's talk about a danger that is particularly striking, because it rarely comes from anyone doing something careless. It usually comes from people doing exactly what they believe is the responsible, health-conscious thing. This class of medication, closely related to the one we just discussed, can raise potassium levels in the blood. For most people, under normal monitoring, that stays comfortably within a safe range. But add certain everyday choices on top of it, and the picture can shift in ways nobody saw coming. Here is where it gets genuinely counterintuitive. Potassium is not just hiding in bananas or supplement bottles. It is hiding in products marketed directly as the healthier option, sitting right there on the same shelf as regular table salt, often labeled as heart-friendly. Many popular low-sodium salt substitutes replace sodium with potassium chloride. So someone who has been told repeatedly to cut back on salt reaches for one of these substitutes, uses it generously on every meal because it feels like the responsible choice, and without realizing it, begins loading their system with potassium, while already taking a medication that raises potassium on its own. The combination can push potassium high enough to interfere with the electrical rhythm of the heart. And here is what makes this particularly dangerous. High potassium does not always announce itself loudly. Sometimes it shows up quietly as unusual muscle weakness, a persistent tiredness that will not lift, cramping in the legs, tingling in the hands, or a fluttering, irregular heartbeat. Sometimes there are barely any symptoms at all, right up until there are serious ones. Think for a moment about anyone in your life, maybe even yourself, who has switched to a salt substitute recently while also taking one of these medications. That is a conversation worth having with a doctor, not because the medication is dangerous on its own, and not because potassium-rich foods are something to fear, but because the combination, without anyone realizing it, can quietly build into a problem that never needed to happen in the first place. Electrolyte powders, certain meal replacement shakes, and sports recovery drinks can carry meaningful potassium loads too. Nobody thinks to mention them at the doctor's office because they are not prescriptions, and that is exactly why they slip through. There is one scenario that almost never gets enough attention, and it affects people on these medications more than almost anything else we have covered so far. What happens to these drugs when you simply get sick? Not a serious hospitalization, just an ordinary stomach bug, a few days of vomiting, diarrhea that will not quit, a loss of appetite, or even a hot week with heavy sweating and not quite enough water intake. When your body becomes dehydrated for any reason, the exact same dose of medication that was perfectly calibrated for a well-hydrated body can behave completely differently. Blood pressure can fall too low, kidneys already working harder because of the fluid loss become more vulnerable. Dizziness, weakness, faintness, or even kidney strain can develop faster than anyone expects. The medication itself has not changed at all. What changed is the internal environment it is operating in, and suddenly it is working in conditions it was never designed for. This is one of the most practically important things anyone can know. Illness changes the rules. And if there is no plan in place for what to do when illness strikes, whether to pause a dose, when exactly to call for guidance, which symptoms should trigger a same-day visit, there is a real gap sitting quietly in your safety net. That plan should come directly from whoever prescribes the medication, ideally before it is ever needed. If it does not exist yet, it is worth asking for at the very next visit. What should be done with this medication during a stomach virus, or if food and fluids cannot be kept down? It is one of the most important questions anyone can ask, and it is one of the least commonly asked. Now, picture a completely different kind of week. Your joints are aching, your back feels stiff and unforgiving. You head to the drugstore and reach for something you have used for years without a second thought, an ordinary over-the-counter pain reliever from the anti-inflammatory family, sitting casually on a shelf that anyone can walk up to and buy. Now imagine that alongside one of these blood pressure medications and perhaps a water pill layered on top for additional fluid management. That combination, used regularly, can meaningfully reduce blood flow to the kidneys. And in the context of even mild dehydration, the risk of kidney injury climbs substantially. This is not some rare hypothetical situation tucked away in a textbook. It is one of the most common, most preventable scenarios there is, and the reason it slips through so easily is simple. People rarely think of an over-the-counter pain reliever as a real medication in the same category as a prescription. It feels like something separate, something minor, just a tablet for the pain. But the kidneys do not care whether something came from a pharmacy counter with a prescription label or straight off an open shelf. They respond to chemistry, not to packaging. If pain relievers from this family are a regular part of managing arthritis, joint pain, or back pain, and any of these blood pressure medications are also part of the daily routine, that combination deserves a direct conversation with whoever is managing the prescriptions. There are often safer alternatives available, different pain relievers, topical treatments, physical therapy approaches, options that do not carry the same risk to the kidneys. Nobody has to simply endure the pain, and nobody has to quietly accept a risk they never knew existed. There is almost always a better path. It just takes someone pointing it out. There is one more sensation worth spending real time on, because it sounds small, and it absolutely is not. That brief, wobbly moment when standing up too quickly from the couch or getting out of bed first thing in the morning. The world tilts just for a second. A hand reaches for the doorframe. It passes, and the day continues as if nothing happened, dismissed as simply standing up too fast. Here is what matters. In older adults, a few seconds of dizziness is enough to cause a fall. A fall is enough to cause a fracture. And a fracture, especially a hip fracture, can quietly derail an entire health trajectory in ways that can take years to recover from, if full recovery happens at all. This is not exaggeration for effect. It is simply how physics and biology interact. The dizziness happens because the medication is doing exactly what it is meant to do, lowering blood pressure. When you stand up quickly, your cardiovascular system has not had a moment to catch up and compensate. Blood pressure briefly dips. Blood flow to the brain momentarily decreases. That registers as a light, tilting, floating sensation. The fix, in most cases, is refreshingly simple. Rise slowly, sit at the edge of the bed for a moment before standing fully. Hold on to something stable while getting up. Give the body a few extra seconds to adjust to the change in position. But beyond that practical habit, dizziness that happens regularly, dizziness that does not fade after the first few weeks on a medication, or any episode that feels close to fainting, those are signals worth a real conversation. The dose might need adjusting. The combination of medications might need a second look. Hydration habits might need attention. Staying silent about this particular symptom is never the safe choice. One last thing deserves attention, because it quietly creates a great deal of unnecessary anxiety and occasionally leads to impulsive decisions that make things worse rather than better. Blood pressure is not a single fixed number sitting still all day. It shifts constantly, hour to hour, in response to dozens of factors. How well sleep went the night before, whether caffeine was involved, whether something is causing physical pain, anxiety about the reading itself, which sounds strange but is remarkably common, having just walked in from outside, speaking energetically right before sitting down to measure. A single high reading on a rough Tuesday morning after poor sleep does not mean the medication has stopped working. A single low reading after a dehydrated afternoon in the heat does not mean the dose is suddenly too strong. What actually matters is the pattern over time, measured consistently, same arm, same time of day, after a few quiet minutes of rest, without rushing or talking. When readings are checked inconsistently and reacted to emotionally in the moment, the decisions that follow are rarely good ones. An extra dose taken out of fear. A skipped dose because one reading happened to look reassuring. A frantic call about a number that, in context, was completely unremarkable. The better approach is to track patterns over time and bring that record to an appointment, letting the overall trend guide the conversation rather than any single alarming number on a given day. That one shift in approach reduces anxiety, improves decision making, and gives whoever manages the prescription far more useful information than a single screenshot from a home monitor ever could. These medications work through a steady, consistent presence in the body, not through spikes and gaps, not through extra doses taken out of worry, and not through skipped doses on days that happen to feel fine. They are not designed to be taken reactively, the way a pain reliever might be reached for the moment a headache appears. They are quiet, daily workers, doing their job in the background whether anyone is paying attention or not. And that is exactly why understanding them, really understanding them, changes everything. The swelling that looked like heart failure, the cough that lingered for 11 months before anyone made the connection, the throat swelling that can never be waited out, the salt substitute quietly loading potassium into a system that did not need more, the stomach bug that changes the rules overnight, the pain reliever from an ordinary shelf that was never as harmless as it looked, the wobble when standing up that could end in a fracture. Every single one of these stories starts the exact same way, with someone who had no idea what to watch for, and ends the exact same way too, with the realization that the difference between fear and confidence was never about willpower. It was about information nobody had ever taken the time to explain clearly. Now that you have it, the next time your body sends a signal, you will know whether it is something to simply note and mention at the next visit or something that means picking up the phone right now. And that difference alone might be the single most valuable thing you take away from everything you just heard. Think back for a moment to how this all started, with a simple question about a pill taken every single morning without much thought at all. That question was never meant to make anyone feel foolish for not knowing the answer. It was meant to expose a gap that almost nobody ever gets the chance to close because a rushed appointment, a printed label, and a quick conversation at the pharmacy counter were never designed to explain any of this properly. Nobody sits down and walks through what each of these medications actually does, what its particular fingerprint of side effects looks like, or where the line sits between something ordinary and something urgent. That gap is exactly where fear grows, and it is exactly where stories like the swollen legs, the 11-month cough, and the quiet climb in potassium all come from. Here is the part worth carrying forward. None of these medications are the enemy. Each one exists because it does something genuinely important, easing pressure on the heart, protecting blood vessels, giving kidneys a lighter load to carry over years and decades. The danger was never really the medication itself. The danger was always the silence around it, the swelling nobody mentioned, the cough blamed on pollen, the salt substitute nobody thought to bring up, the pain reliever picked up without a second thought, the wobble dismissed as nothing. Every single one of those silences had a simple fix, and that fix was a conversation that never happened until it was almost too late. So here is the real takeaway. Knowing the category tells you the pattern. Knowing the pattern tells you what to expect. And knowing what to expect turns fear into something manageable, something you can actually act on instead of simply worry about at 2 a.m. while searching for answers online. The next swollen ankle, the next persistent cough, the next moment of dizziness getting out of bed, none of those have to turn into weeks of anxious guessing. They can become a short, specific conversation with whoever manages the prescription, the kind of conversation that resolves things in days instead of months. That is the entire difference between living with quiet uncertainty and living with real confidence. And now that difference belongs to you.